Welcome, everybody, to the Animal Medical Center's Living Legends 2020 Award Ceremony. While I'm disappointed that we can't do our Living Legends Awards in person, I am grateful that we'll be able to get together today virtually to share the stories and the miracles that happened at the Animal Medical Center this year. And I'd really like to thank not only all of the veterinarians and staff, but especially the owners of today's awardees. For the last 110 years, the Animal Medical Center has served a vital role in the veterinary profession. Having the single largest education program, nearly 20% of all of the specialists in this country have spent time at the Animal Medical Center. All during this recent pandemic, the Animal Medical Center remained open 24 hours, 7 days a week. We were able to serve each and every client that came to our building for care. And as the pandemic got worse and worse, we seemed to see more and more animals, and I am absolutely so proud of the staff that we have at the Animal Medical Center. They were here every day, 24 hours a day, taking care of every pet that came through. The pandemic also has put a little bit of a pause on our Gift of Love campaign and our capital project to expand the building. I'm happy to say that we're going to be moving forward with that once it's safe to start construction. That project is integral to the success and the longevity and the sustainability of the Animal Medical Center. Now is the time to meet this year's Living Legend awardees. One of the unique things about the Animal Medical Center is the huge caseload. Last year alone, we saw over 56,000 visits. AMC is also very special because of the doctors that we have at the Animal Medical Center. One special doctor that we have is Dr. Katie Kennedy. She's one of the few boarded surgical oncologists in the country, and she's the only boarded surgical oncologist in the New York City area. Today, she's going to give us the story of Lola, a very unique case, something that couldn't have been done anywhere else in the world except at the Animal Medical Center. Dr. Kennedy?
Thank you, Kate. I first got to meet Lola and her family in the spring of 2019 when they came to the AMC Cancer Institute after going to their vet for a bump on top of Lola's head. Their vet was able to diagnose her with a bone tumor that unfortunately extended through her skull and down towards her brain. She came to us to see what options we could have to save her life, given that she was only 11 years old and a Chihuahua who was otherwise in good health and had many good years ahead of her. Unfortunately, the biopsy showed that she had a form of bone cancer. And luckily for her, it was not the kind that spreads, but it was a kind that was very locally invasive. And so she came to the AMC to see what other options she might have. And given that it was more of a local tumor, we decided that surgery was going to be the best chance to be able to save Lola's life. It would be an extensive surgery, removing the entire upper portion of her skull, essentially performing brain surgery, which was all that more important to her family, as her owner, Dana, had also gone through brain surgery when she was younger. So that made this emotional and impactful for her whole family. We were able to perform the surgery. She had no fewer than 4 specialists working on her throughout the procedure at any given time. We actually had to order some special titanium mesh from Europe to be able to reconstruct her skull. And the procedure itself took over 6 hours. She luckily did very, very well with her surgery. She went home after just 3 days in the hospital recovering and never looked back. Now, over a year later, she continues to play and bring her family joy at every moment. Lola, it's my greatest honor to give you and your family this award for the Living Legends 2020.
Thank you very much, Dr. Kennedy. That was an amazing story. Today, we're going to share the story of Olive, and Dr. Catherine Creecraft, one of our residents in critical care, will tell you the story of Olive. Dr. Creecraft, welcome.
Olive, a 9-year-old cat, presented to our emergency room in November after her owners had noticed that she had kind of not been herself for the last couple of days and was having some trouble breathing. Prior to this, she had been a healthy cat, but she does go outside and she had gotten into a fight with another cat a few weeks before. When Olive presented to the emergency room, she was bright and alert, but she was definitely having some trouble breathing. When I put my stethoscope on her chest, I had a really hard time hearing her heart sounds. So we used our cage-side ultrasound to look at her heart, and what we found was a very large amount of fluid within her heart sac or her pericardium, and this was actually putting pressure on her heart so that it was having trouble beating, and this can be a life-threatening condition. So what we did is we sedated her, and we put a needle into her chest to quickly remove that fluid and relieve the pressure. When I looked at the fluid under the microscope, there was a large number of bacteria in it, consistent with a really severe infection. Olive's care was truly a team effort. We started by having our cardiologist do an echocardiogram or a sonogram of her heart, and what we found was that the chambers and the valves within the heart were normal, but they were worried that there was something that there shouldn't be, like a piece of foreign material within the heart sac itself. So we did a CAT scan of her chest and abdomen to make sure that we didn't see any abnormalities anywhere else, and the radiologists confirmed that there was nothing else abnormal. Then our internal medicine service, the critical care team, and the interventional radiology team put their heads together, and what we decided is that we should probably take Olive to surgery. We wanted to go in and see for ourselves exactly what was going on. So Olive was anesthetized and she had open chest surgery. What we found is that a tiny little piece of grass had somehow made its way into her heart sac and was causing the infection. The grass was removed, and we actually ended up removing a good portion of her heart sac as well and flushing out the infection. Olive had a chest tube placed and a feeding tube placed as well to help with her recovery. Olive's recovery from such a major surgery was pretty slow. She needed a lot of pain medication, oxygen therapy, and she got a blood transfusion during this time as well. Unfortunately, we're worried that Olive had a small stroke during her recovery, which slowed things down as well. About 2 days after surgery, she was able to breathe comfortably without oxygen and started to be a little bit more aware of her surroundings. Olive was discharged from the hospital 6 days after her surgery, being able to walk, eat a little bit on her own, and purr. When we saw her for her first recheck when her sutures were removed, she was doing better and better, and she never looked back after that. 1 month after surgery at her recheck exam, she was back to her normal self and we were able to remove her feeding tube. I'm so proud to have been part of Olive's care here at the hospital and that we were able to get her home to her family. And I'm so honored to present them with this award today.
Mrs. Flaherty has been a board member at the Animal Medical Center for many years. She had an amazing dog named Jackie. Mrs. Flaherty established the Courage Award in Jackie's name, and each year we choose a dog that demonstrated the same amount of courage that Jackie did. Today's awardee is Dudley. Mrs. Flaherty will say a few words about the award, and then we'll have Dr. Leilani Alvarez tell us the story of Dudley.
Thank you, Kate, for that kind introduction. As you just heard, my name is Tina Santi Flaherty, and I'm a very, very proud board member of the Animal Medical Center for many years. I'm proud because we're called the Mayo Clinic for Animals. For 12 years, I was the lucky dog mom of Jackie Santi Flaherty. Jackie was a beautiful white Labrador retriever, and to say that she was very special to me is quite an understatement. She was not only beautiful, but she was brave, much like my neighbor, Jacqueline Kennedy Onassis, who Jackie is named after. At age 8, Jackie was diagnosed with cancer. It could have been a death sentence, but thanks to Jackie's bravery, her will to live, and the extraordinary care the Animal Medical Center gave her, she lived many years beyond what everyone thought was possible. To recognize Jackie's tremendous courage and to thank Dr. Leilani Alvarez and Dr. Ann Hohenhaus, as well as the Animal Medical Center, for their excellent care, I decided to create an award in Jackie's honor. This award is given each year to another dog who has demonstrated similar bravery throughout an illness. The 2020 award comes with a gift that will be designated to the Rehabilitation Service. It will ensure that other pet patients can benefit from healing treatments as much as Jackie did. I will always, always love and miss Jackie, but the award for courage will enable her to live on in our minds and hearts. This year, the recipient of the award is a very special dog. It's Courage, and Courage is all about Dudley, a miniature toy poodle who was hit by a truck and expected to never walk again.
I'd like to now introduce Dr. Leilani Alvarez, who will tell us the story of Dudley. Dr. Alvarez is the director of the Tina Santi Flaherty Rehabilitation and Treatment Center here at the Animal Medical Center. She is an expert in all aspects of rehabilitation for all animals, not just dogs, but we've seen her work with cats, rabbits, whatever needs to be rehabilitated. Dr. Leilani Alvarez can do it. She's also one of the few doctors worldwide who has a special credential in canine sports medicine and rehabilitation. With that, I'd like Dr. Alvarez to give us a story of Dudley.
I first heard about Dudley on a warm summer evening on a Saturday when I was actually at the pool with my kids. I knew that this was a special case. A critical care doctor at another specialist facility was calling me about a patient that had endured severe trauma, and they wanted to transfer the patient to the Animal Medical Center's rehab department. She described an 8-year-old brown toy poodle who had been struck by a garbage truck in Central Park, having a shattered pelvis, a serious hernia, and extensive nerve damage. He required multiple blood and plasma transfusions and surgeries to repair the pelvic fractures and the hernia. Now, the good news is Dudley was alive and stable. The bad news is that Dudley was completely paralyzed. The critical care doctor consulted with multiple New York City community veterinarians, and the consensus was that if Dudley was ever to walk again, he needed to be transferred to the Animal Medical Center's Tina Santi Flaherty Rehabilitation and Fitness Department. So, of course, I accepted the transfer of the case. When Dudley first arrived at the Animal Medical Center, he had a urinary catheter because he was unable to urinate on his own. He had a large intravenous catheter in his jugular vein to administer vital medications, and he had a feeding tube. So definitely not the typical kind of case that I take care of in rehab. Nonetheless, when I looked into Dudley's soulful eyes, I saw a lot of fear, but also a strong will and determination to never give up, and I knew I was in it for the long haul. Multiple doctors had predicted that Dudley would never walk again. But when we admitted Dudley to the AMC, we performed intensive daily rehabilitation in addition to acupuncture treatments, and our entire team was committed to his care and his recovery. We tried to take him outside at least once a day to enjoy the fresh air. We went actually over by the East River so that he could actually see something beautiful, feel the grass under his feet, and even if just for a few moments, to feel like a normal dog, to help him cope through the hardship that he was enduring in his recovery. We began with simple rehabilitation things like learning how to get up, how to stand, how to take your first steps with assistance, eventually working up to hydrotherapy with the underwater treadmill and swimming, and eventually to him taking his first unassisted steps. Now, we did meet several hurdles along the way. Dudley developed urinary tract stones, causing blockage and an inability to urinate. He required emergency surgery with our interventional radiology team here at AMC, and he also required several surgeries to repair skin wounds that had developed due to his inability to walk. Although nobody would have believed it when Dudley was first admitted on that fateful day in July 2019, the miracle of Dudley is here with us today, and he has demonstrated not only his tremendous courage, but his stubborn will to never give up. And just like Jackie Flaherty, the beautiful yellow lab that this award is named after, Dudley has demonstrated an amazing will to live, tremendous courage, defying all the odds despite severe fractures and paralysis. And he's here with us today, stronger than ever, cuter than ever, and walking. And we'd like to present the Tina Santi Flaherty Award of Courage to Dudley for the tremendous courage that he has shown and persevering through the severe trauma that he endured and coming forth walking again. Congratulations, Dudley. We love you so much, and we look forward to seeing your continued improvement and enjoying the excellent quality of life you do today.
That concludes our award ceremony for today. As you know, the Animal Medical Center is a unique institution, and we depend upon generous donors such as you all today to help us fulfill our mission of compassionate care, education, and research. Again, my best wishes for your good health. Thank you.